What's up, everybody? Ruben Davis, Future Doc here with two of my fellow Future Docs. I will let them introduce themselves.
Hi, I'm Raisa.
My name is Darius.
Y'all have seen Darius in previous videos and Ryza in the premature video. This is the gang right here, the premature gang and the distinction gang, you feel me? So in today's video, we're just gonna recap our M1 year. Like we just finished up, how are y'all feeling?
Happy to be done.
Honestly, yeah, it's good being done.
For sure. It's definitely a much needed break. I've slept a lot,
A lot.
like way more than I probably should have, but I had to make up on some sleep.
More than I've slept in this whole month.
Right. So, officially finished. And so first question, looking back on M1 year, like was it what you expected?
Definitely not what I expected. I knew it was going to be difficult, but there's so many different things to balance our time. I think that's probably the hardest thing for me is all the extra assignments, all the other things you have to do, and that life doesn't stop.
I would say in terms of like difficulty, it was about what I expected. But like you said, like juggling life plus that difficulty, and then it's like, you know, the constant change from block to block. I was a little rough to get through. But,
Yeah.
yeah.
And so to, I guess, give a little insight on how our school is structured. So we have lectures from 8 a.m. to 12 p.m. every day. And then in the afternoons, we'll have one of our longitudinal courses that could be PCM, our small group, or which is practice of clinical medicine, so like the doctoring class, like where we learn how to do physical exams. We might have like PPS, which is physician patient society, population health, geriatrics, what else? Am I missing anything? What else?
Interprofessional,
IPEC,
whatever
IPEC.
that stands for.
Low key waste of our time. But I get the point of it, but at the same time, it's like I'd rather be doing something else. Just being completely honest. Some of these is like I just rather be doing something else. Like I see the importance of this, but like I could have just looked at the slides.
But the
And
mandatory sessions, though.
yeah, so it's very grueling, it's very constant, very fast paced. Like our blocks are both like normal and pathology. So we have everything at once, where I know some schools do it differently where you get the normal once like first and then you get the pathology second. So you get like 2 looks at stuff, but we get 1 look. Some of them like our average like 2 weeks, 4 blocks, 2.5 weeks. Our longest block I think was like 3 weeks. I think for our first year, right?
I think I was like all of November.
True, because it was two.
Two,
That was
yeah.
like it was like splitting the two, but it was basically the same thing. Yeah, that was long. Oh God.
I know.
Ooh, I don't know. I almost ain't make it. I almost ain't make it through I and I. But to answer my own question, looking back, was it what I expected? Similar to Darius, of like it was the difficulty level was kind of around where I thought it would be, but I guess like just like I expected to be a lot of information, but it was still even more information than I thought it was going to be. Like just every day, like some people like are having slides like over 100 slides, 80 slides. Like, it's
For
just
one
for
lecture
one
hour.
lecture hour. It's like how and some of them sometimes they get through it, sometimes they don't. And like trying to sift through what's important and what's not important is like, that's a skill that you have to learn. And so I will say not really what I expected, a little harder than I expected. So what was your biggest challenge?
My biggest
Yeah,
challenge,
I wanna hear.
I think going back to like life, I tended to like cut out a lot of stuff that I like to do that first semester, and I mean, I did well, but that was just stressful for me. So second semester, I prioritized a lot of like my health, my personal, just like mental, physical, and just taking breaks. Um, and that still did great, and I feel so much better for it. So yeah.
Yeah. I'd probably say mine's the same. Getting enough sleep,
Mhm.
eating well, not eating out, trying to find time to go to the gym, and like
The gym. You go to the gym?
Trying to find time not to go to the gym. Trying to find it. I didn't find it yet. But M2 or coming
Still
up.
searching. I'm still searching. Where's Waldo?
But yeah, exactly. It's hard to try to do that when you're like, I only slept for 4 or 5 hours every night. So how do you have energy for anything? That's probably the hardest thing.
Yeah, you kind of see the theme here, light, balance. And similar, it's for me, but I'll probably, I guess, go in a different direction in terms of like just like pure curriculum, like learning how to study again. Like studying in the difference between studying undergrad and studying in med school is like night and day. It's completely different because you're getting new information all the way to like 3 days before the exam. You're having we're having lectures every single day of like new material. And so it's like you can go a week where you're going to class every day, but you haven't reviewed yet and you don't know anything. You're like, you get to a week, in a block and like, I know nothing, and we're having these mandatory sessions, these TBLs, whereas like we have to know some information to answer this TBL and participate with our group. And it's like, you know what's going on? Did you review this lecture? And so like maybe that morning you reviewed some of the slides and the PowerPoints because you have like your individual quiz, then you take the same quiz again as a group. And my group was holding me down for both semesters, you know what I'm saying? And of course sometimes I was more prepared than others. And that really takes, talking to your group like, hey guys, I don't know nothing, just like being honest about it. But I would say studying was really like figuring that out, like figuring out how to adjust quickly to the new block and figuring out like, okay, this new information, especially like going from like pure didactics to being in the anatomy lab, like that was like, a big change of like, okay, we only got 1 hour of lecture versus, you know, whatever, however many, 4 hours a day. So, like learning to be very adaptable and learning like how you learn best is an adjustment for medical school. And I would say make sure you think about like how you learn yourself and also use your resources. Like go to if your school has an academic skill or something like that, go talk to them. Get them to help you out, talk to your professors because it will be helpful as you transition.
Yeah. There were so many times where I was looking at slides and I was like, this is definitely not going to be on there. Number one.
No, literally, the things that you're like out of scope, low yield,
Yeah.
be the thing that pops up. That just like
We don't need the Latin word.
you'll be
It's
like,
fine.
exactly.
You
Like,
do.
like I know exactly what slide this is, but I can't tell you what's on it.
Yep.
I can't tell you what's on it. And so, yeah. And I think too, like the second and third level questions, where it's like undergrad, you're kind of just used to learning the surface of a subject, where it's like they're gonna give you the disease. Like you're like, oh yeah, I know exactly what disease this is. This is Burkitt's. But they're not gonna ask you to what's the diagnosis. You gotta learn it, you gotta know the diagnosis, you gotta know what causes it. Then they're gonna ask you some random question about like
What's the risk factor?
yeah, what's the risk factor? But they're not going to tell you what it is. You have to figure out what it is, what that diagnosis is, what, it's like certain treatments are, whatever. And then they're going to ask you a question branched off of that after you done figured out what it was,
The mechanism of the antibody of that disease.
Exactly.
Oh.
Like, this is not a treatment question, because we didn't ask you about treatment, but you got to know the treatment because you got to know the mechanism of that treatment. You know what I'm saying? Like, little stuff like that. That's why, this stuff's hard. And that's definitely some challenges right there. And there's so many more we can go into, but I'm trying to make this a shorter video. So what was your hardest block? I'll let that sit for a moment.
I already answered this question. My hardest block was I. For me, I'm a very conceptual person. I like concepts. And I was straight memorization.
Straight.
So I hated that. And I still hate it. I'm actually studying it again.
He literally was studying it. When I met him, he's like, what do you study? I'm like, this is not like prematric stuff, like, because he's helping out with prematric. And I'm like, this is not prematric material. He's like, nah, this is I, bro. So step one.
Because I'm trying to hammer this in. And I hate, like, I can do concepts. If you give me a concept, I can kind of work my way through it. If you give me something to memorize, it's just, I'm going to remember it and then I'm going to forget it. So that was hard for me. Plus, it was 4 weeks instead of like the regular 2.5, whatever. So I was just tired, mentally drained. It was the first semester, so I wasn't really taking care of myself. I mean, yeah.
First semester was rough, man. It was rough. It was just a complete adjustment period. What was the hardest block for you?
I'd say most of the semester, really.
Second semester or
Yeah, no, this semester, because I guess I'm more the opposite. Like, I mean, other than the anatomy part, like the anatomy labs were like, I'm good at memorization. So I was like, pharmacology, like I'm like, okay. And then like I straight memorization, biochem, okay. But this with marrow, like hematology, oncology, when you give me someone that's just like, they have this thyroid condition or calcium and they're all the same. And we have 100 questions that are like, this person has nausea, vomiting, and diarrhea. What's the diagnosis? There's like one tiny thing that's different. Like this
Yeah.
person stubbed their toe last night. Now what do they have? And I'm like, what? What? Yeah, those things are bad for me.
Yeah. Shoot, the hardest block for me, I is definitely top two. That was definitely top two because it's like I'm very strong with immunology, but immunology was like this much. Whereas like it was like 10% versus 90% was all micro of like what bug is this? Like all of these different bugs. And I was like, I can't. I'm more of a conceptual type person too. I need something tangible where it's just like they were swimming in a river in Saudi Arabia. You know what I'm saying? Like, you know, and so that was,
That's
hard
makes
for
sense
me.
to me. You're like,
Yeah.
it's not that Saudi Arabia was a job, but there was like a desert one. It's
Yeah.
like if they're in the desert, it's clearly
Yeah.
this.
They're in Italy. They're swimming in a river in Italy. And he got bloody pee or something, like some weird random just facts you just gotta know about all of these bugs and differentiate it. But I would say marrow.
Yeah.
Marrow was doing numbers because it was a lot of histology in marrow. It was a lot of histology and just overall, like I feel like it was made like it was taught kind of complicated to us. Like we would have these TBLs where it could be this, it could be that, it could be this, and he's not really like giving us the answer. It was so those TBLs, those was the most stressful TBLs we ever had because he's picking the tables, like we answer the question, he's like, table 2A, what'd you pick and why? Like, oh yeah, we must have got it right. We
Yeah,
got it
you're
right.
like, we chose C, and then he's
Because
like, it could be, maybe.
but it's not.
It could, but then he was also like, it could be B. It could also be D. And I'm like,
I was like, bro, what
what's the
is
right
it?
answer for the exam though? And he was like, all of those. What?
Yeah, and so like learning the differences in a histology where they all just look purple, and just learning like I feel like those we had to learn like the translocations, like some of the genetics factors of that. And so that group study session we had really, really, really did one for that. Let's see here. What else? So we talked about hardest block. We talked about like looking back in our biggest challenges. What's something that you would do differently now that you have this information? I guess like what are you going to do different in M2 year?
I would not let my personal health and like well-being fall to the wayside just to get the study hours in. I think I do so much better, and probably everyone does so much better when you take care of yourself. So to say like, oh, I'm just not going to get any sleep and study till 2 a.m. and then wake up for class at 8, I'm like, this is not a good idea. Just go to bed. Like you're not learning anything when you're staying up and you're just dead.
If you're not retaining anything, just stop.
Yeah.
Just stop. But for me, I would say going back to the group studying, I'll definitely do a lot more group studying. I feel like I'm a very individual person. I like to study by myself, but group studying kind of helped me to like challenge my thinking and make sure that I was understanding the material the way that you know maybe that was it was actually supposed to be taught and not the way that I was pretty much. But yeah, no, definitely a lot more group studying.
Group studying was very clutch because there are certain things because you got certain people like me who are very big picture. You know what I'm saying? Like I can tell you like the big picture. Then you got certain people like Fallen, for example. Shout out to Fallen, who is very much so into the weeds on every slide of like, and she remembers like stuff that the lecturers say. Like, no, she said this in class about this thing, and you're like, I don't even remember that, bro. Was I even there? And so like you get those different perspectives because everybody retains different information for different reasons. And something you didn't study, they studied, and they can teach it to you. And I don't know, for me, it just sticks when one of my classmates teaches it to me versus when a professor teaches it to me. Like we group study or we just talking about something random, and somebody will say some one random fact. Like for example, when we group studied at Alexis Jones and that cyclic GMP question,
Oh yeah.
like it literally popped up on the exam. Like we talked about it randomly, just like kind of quickly, like like that one fact that we had talked about in passing something that is something that I remember that I wouldn't have looked at and I wouldn't have got right if I didn't group study. So definitely group study is a big benefit. And I would say even weekly like review group studying is something that's like could be really beneficial just to like keep you on track with the information. But I would say something I would do differently is because like I had my biggest issue I feel like was balance and like staying like on top of things and staying motivated. And I think one way I could like improve that is by like actually adhering to a certain kind of schedule and like a routine. And I didn't really have a routine because like I feel like, you know, it was just like all the time. Like I would just want to like sleep. I would just want to relax. And so I would like lean into that kind of like desire a little too much sometimes. Whereas like, you know, if I stayed on a routine earlier enough, like I don't have to like study long hours closer to the exam because I've been being consistent with like studying, you know, a few hours every day, reviewing the material every day, where it's a lot, but it's a lot less than having to be stressed, you know, a few days, you know, even a week before the exam. So like definitely setting a routine for myself and like, you know, really developing some discipline with like, you know, adhering to that routine. And so kind of talking about studying, that's a good transition. Like, how has your studying changed? And like, what are your favorite resources to study?
I love Sketchy. I wish there was a Sketchy for everything. Just draw the picture, and I'm like, okay, I got what you said. Um, It's definitely I mean, I used to and I still kinda do sometimes because a lot of times with, so many PowerPoints and so many different slides, it's hard to consolidate, but I would spend more time consolidating my notes than I would actually spend learning it. So I'm like, "Oh, I spent hours kind of not rewriting the lecture notes, but making sure, like, you have all the stuff in one page." But then when it's time for the questions, I'm like, "I still don't know it, even though I wrote this for who knows how long." So, Sketchy and Anki, really, for me, is just the repetition.
For me, that was a big question. I'm a big question kind of guy. I like to test myself. And I used the PowerPoints pretty much solely for like exam studying. But in order to find my questions, because there's only so many questions that school gives you, I would go to like Boards and Beyond, USMLE, UBoard, just to kind of like quiz myself, UWorld, just to kind of quiz myself and make sure I was understanding the material. Also, using those outside resources questions versus the like questions that they give you in class, whatever, kind of helps you to think of it in a different way because somebody else is asking you the question and they don't know what you learned. So you got to kind of like apply that to their question, which I thought was really good. So,
Yeah, I would say the big change for me, like personally, was like the intention behind how I'm studying of like instead of just like rewatching this lecture of like, okay, let me take it one step at a time and like let me actually try to intentionally pay attention to what they're saying so that I'm not just like passively just watching a video on 2 times speed. Like, let me pause it real quick. Let me write that down. Let me make sure I understood like this concept. Let me make sure I understood this physiology of like especially like in repro, which was our last block. Like I felt like, you know, I did that like the best, where it was like it was a lot of physiology of like menstrual cycles and stuff like that. And like making sure that I understand like, okay, this is where this hormone comes in. Why is it coming in at this time? What does it do? Because like they stressed like this was really important and like was pretty key to like understanding like a lot of the other things they talked about like with precocious puberty and menopause and all that type of stuff. And so like really understanding that physiology and taking the time to like break it down the first time so that you understand it, I think goes a long way and just like being really intentional. I loved osmosis because they have a lot of visuals. They also have questions. I didn't do their questions a little bit too much, but I like their videos because they sort of visually show it to you, and they had like these high yield notes that also had like a lot of pictures that I can kind of take and put in my own. Um, Hated Anki. I don't use Anki. Anki is just the worst for me. Because I get bored easily, like doing Anki. I just kind of like, and I felt like if I didn't make them myself, everything was out of scope. So, yeah. For anatomy, I liked, like, the 3D anatomy stuff. I like
Blue
the
Link,
Blue Link for Michigan. Um, I started to use UWorld a little bit towards the end. Also, we had the USMLE RX, that we got through the school. Those questions I actually found were really good and pretty in scope for the things that we learned. But I would say osmosis, pathoma, big one. big one.
That's a good one.
That's the GOAT.
Yeah.
All right. Pathoma is goated because like you're gonna learn pathology. Like pretty much sometimes there were certain things that they didn't talk about as much. And that was another thing. Like if you're not a class goer, you have to look through the slides because sometimes if you're using third party resources, some of that stuff is going to be out of scope based off of what they teach you in class. So like I had to balance that a lot sometimes with like whereas like if I'm not going to class but I'm watching these third party resources where I'm like and I start talking about it with other classmates like, oh yeah, we don't need to know that. I'm like, you're kidding. So like, that's another minus to maybe not going to class. And I've done some videos. Y'all probably I don't know if y'all seen them, but some I've talked about whether to go to class or not. Okay. Moving forward. So let's get into, I guess, more of the positive vibes. What is your favorite thing about med school? Whoever has it first.
I guess I would say just like, especially this last semester, just like being able to take what I'm learning and kind of apply it to these clinical questions, these clinical correlates. Um, I mean, I was a big fan of Marrow. I'm sorry.
Yeah. Tomato.
I was a big fan of Marrow because it was like this. It was just a huge puzzle. It was you get like these oh my goodness, these CBC complete blood counts, and you go like try to work out the anemia.
Terrible.
I would say when you got it,
Yeah,
it was so satisfying.
it is
It was so
amazing.
satisfying.
Like just being able to like diagnose the patient in the question, even if you got the question wrong, because it asked you like what the risk factor for that was, and I didn't know that. But just to be able to be like, oh yeah, I know exactly what this patient has was amazing. I think so.
Yeah, I will say I can agree that that is a very satisfying feeling. Meryl was one huge puzzle, and it was like the first time where we really had to like understand the labs. Where we really had to get into the labs of like you got to know if this is a micro, macro, normal anemia, like like kind of understanding those things and those. It feels like you're like actually becoming a doctor. You're like it feels like this is doctor stuff. Um, what about you, Raisa? What's your favorite thing?
I'd probably say anatomy. I
Mm.
really liked that we had the lecture and you can see all this on the slides, and then, you're kind of like, okay. And then you can go actually, cut someone apart and see it for real. So I guess it
Not
just
a live
brings,
person, people.
yeah.
We had donors. That
But
were
then it's
there.
also like it does translate to a real person. So it's like, hey, if you're thinking about surgery and, even like all the abdomen, like the GI things, clearly we're not going to be able to just open someone's stomach and leave it open for hours and
Right.
everything else. But then you're like, hey, if you can see this here and see how it's displayed, like now you can see how complicated and like things are in the OR. So I really like that. You can see the diseases, then you can actually see the organs and blood vessels versus just paper.
Yeah. I would say mine is like a combo. I would say PCM. I really enjoy PCM, especially because like I actively saw my growth interacting with our standardized patients, where it's like, okay, I kind of know all the questions to ask now. I know kind of like what to look for when like doing the interview of like, oh, red flag, lower back pain, like, oh, this red flag here, this red flag there, and kind of like taking that note and like interacting with the patient. I always got really positive reviews about my patient interactions. And so like that was always a very satisfying feeling of like, okay, I can do this doctoring part. But then also I would say anatomy, especially GI anatomy, I hated MSK, but GI anatomy was awesome. That was like I started to really enjoy being in the anatomy lab. I wish we could do anatomy the entire time
Yeah.
because 1 hour of lecture and then like 3 hours in the lab, like trying to find stuff where it's like because eventually like certain things about anatomy is like kind of skill based where it's like you got to know how to like open up things and like the proper technique to use so that you don't destroy the anatomy you're looking for. Like whereas I feel like when we first started, like everything was just pure chaos. We didn't know what was going on. We didn't know how to get through the fat. We didn't know like how deep are we supposed to go. And then eventually we got sort of like better at like, nah, we need to keep going. We need to keep going. Let's clean this up a little bit better. And I remember there was a day, Darius is in my anatomy group, so he probably remembers the day we took out the heart, and I was just over there to the side, just like cleaning up the heart, like, cause the heart has fat on it. So I'm just cleaning it up, like exposing like all the blood vessels on the heart and stuff. Like, and literally they're kind of doing their own thing. I'm just in my own world. I'm like, oh snap! Did anybody else want to get in on this?
Definitely very easy to get lost.
Where I was just like, I was just enjoying like that process of just like
Yeah.
exposing and seeing the anatomy that you see in a textbook. Like that was very, very satisfying.
Yeah.
Very, very.
I remember I was doing the sympathetic chain one day in
Mm.
the thorax, and then I was like cleaning it up and everything, and I was like, this is looking good. So then like one of the professors, actually like the Dr. Harrell, came around. So she's like the lead, whatever.
Right.
And she came around, she was like, this is the best sympathetic chain I've seen all day. And I was like, oh my God.
Yeah.
Like clearly this is nothing. It doesn't matter. But I was like, this is great. And I was like telling everybody, hey guys, come look at my sympathetic chain. And then when they used our cadavers for the
Practical.
a practical, they tagged the sympathetic chain on mine because clearly it was the best one. So I was like, cheat code, you guys knew the sympathetic chain was this one. So I was like,
Yeah.
that felt rewarding, even though it's just 1 point, but it just feels like, hey, you did a good job dissecting it, so you get this free point.
Yeah. And that kind of pointed me in the direction of like surgery, of like, because I just enjoyed it so much. I was like, man, I think I'm gonna do like general surgery or something. Like, man, I'm trying to get in this now every day. So anatomy was definitely a highlight for me. It was a lot at first, like being on our feet that long. I had to get some hocus. But after that, like after you get used to it and you kind of develop those skills, like anatomy is really, really awesome. So most people come into med school with sort of a specialty in mind. So what was your specialty in mind when you first came in, and what is it now?
I don't remember what I said on our first video. I think I said I kept it open. Um, I know at the start I was thinking orthopedic surgery, like at the start of this whole journey. But now I think I'm more of a med peds, so I'm going to throw out med peds because you may not know about med peds, but it's
If you don't know, you're gonna know by the end of this video.
it is a combination of both pediatric and adult medicine, and you can specialize. You can do it's so many different options you can go down. And like I said, I a guy who wants to have a whole bunch of options to me, and I feel like that is the best way for me to have that. So we'll see.
Shout out to Med E Darius.
Mine's pretty much the same since I started, I guess, since I just have more background as a surgical assistant. So definitely really like surgery and dermatology. It's really the same way. Being in the anatomy lab, definitely like confirm that because clearly, even though you're assisting, you're not actually, cutting into patients yourself. So that was really different, and I liked it. Um, the dermatology block was had a lot of gross pictures. Lot, but you're like, hopefully everything's not gonna look really crazy. But I mean, still liked it. So I'm probably still surgery or derm.
Cool beans, cool beans. That thing makes so much noise. It was blowing me. Um, so for me, I feel like similar to Darius, like when I first like was thinking about it, I was thinking like ortho, because I like sports, so I was thinking like sports medicine. Um, and then I did MSK. Uh, and then also one of the big reasons I actually got into medicine was maternal health, Black maternal health in particular. And so like OB-GYN was kind of up there, but then we just did repro and we did a pelvic exam. And I said, I can't do this.
I was in the public exam group.
Oh yeah, we were. I
and
was like, I
the
can't,
looks he was giving me.
I can't. I was respectful of the patient, first of all. Okay. But I can't do like 30 of those a week. You know what I'm saying? I was like, I don't think this is for me. And so that was kind of a turn. And I wasn't sure whether or not I wanted to do surgery or not, but I'm definitely pretty sure, like I'm like 95% sure I want to do surgery now, like whichever surgery. General surgery is kind of at the top of the list because I really love that anatomy. But urology is also kind of up there. I shadowed urology this year. And that was pretty cool. Like you can do a lot of different sort of things with urology. But general surgery, like definitely surgery, like I can't just like do patient interviews and like manage patients because I've also done like we've done our observerships and mine was with internal medicine. I was like, this is cool and all, but like some of the stuff you got to go through as an internal medicine doctor. I'm like, I'm not trying to do this every day. Like where
Like
you
round
gotta
for 6 hours.
yeah rounding for crazy amounts
I
of
can't.
time, and you have to figure out like you can't just like release patients all the time. You have to like figure out where they're going. Like because we were at the VA and there was a particular patient who I think had some like drug use disorders. I think might have had some mental health disorders as well. And so like we're calling the family, trying to figure all this stuff out. Like we're basically social services. And I'm like, this is amazing, important work that I don't know if I want to do every day. So surgery, I mean, I'm sure I think there can be some of that with surgery, but like, not primarily. So, and from what I hear, general surgery, you get a lot of patient interaction as well, like from what I've seen. So, yeah, that's kind of where I am with it. And yeah. So, if you guys had to rate in 1 year on a scale of 1 to 10, 10 being like, this is awesome. This is exactly, I loved it. It was amazing. 0 being like, this is trash. I would never recommend this to anybody. What are you rating in 1 year?
Honestly, personally, a 10. I did enjoy it. I
Of
really
course,
did.
this nerd is
I'm a big nerd.
gonna rate it a 10.
That's just me. Yeah.
I think my rating's more in comparison to how I think the future years will be. So for me, this is kind of just get through the preclinical phase to get to the hospital and rotations. So I'd probably rate this like a 6.
I thought you were gonna say like an 8 or 9 or something.
No.
But when you like,
That's one of the. I'd probably rate it like a 6, and then hopefully, I mean, we don't know yet, but hopefully, M3 and M4 being in the
solid
hospital.
10s.
Yeah, hopefully.
And
Even
then
though you'll be busy and stressed still, but
that intern year is gonna come back down to a 5.
yeah, it'll be a 3.
Yeah. But I'd say for me, I was actually thinking a 6 or 7 as well, only because of the recommend part in there. Don't do this unless you really, really want to. You know what I'm saying? Like if you're doing it for the money, the prestige, or any of that, like you're gonna hate yourself. You're gonna hate these decisions and you're gonna be in debt for something you don't want to do. Like really evaluate like, is medicine what I want to do? Is this the lifestyle for me? Because nothing about it is easy. Literally everything about it is hard. There's no easy part. So yeah, I'd give it a 6 or a 7, you know. Um
You're about it.
I'm just trying to get that message across. Like, but like similar to Darius, like if you love it, it's gonna be a 10. Like you're gonna have a great time even through the hard times and the challenges and like the difficulties and the failures you're inevitably gonna have. You're still gonna like find the willpower to push through because it's like this is what I want to do and this is what's gotta happen. So
That's why I emphasize that was for me.
But clearly, he got his life together with the self care, and I didn't.
Yeah,
So
like-
that makes a big difference.
So any advice that you'd like to leave at the end of this video for someone going into their M1 year, or even for some pre-meds trying to get in?
All right. So for going into M1, let's see. I mean, you're gonna hear it again and again and again, but take care of yourself. Honestly, whatever you love to do, keep doing it. Like, just keep doing it. Make time for it. Make time for whatever sport. Make time for whatever book you love to read, whatever movies you like to go see. Make time for yourself. Uh, for pre-meds who are thinking about going in, one, make sure that you really want to go in. Explore all your options. And then also find what you like to do outside of medicine, because that's what's going to get you through medical school. So,
Great words, great words. Definitely stick to that.
For M1s, I probably would say for studying, like get a schedule, get it, get your life together, plan things out. Even if you don't stick to it all the time, it's better to say, I know I'm supposed to study 5, 6 hours today and I need to get through this material. And even if you don't finish getting through that, that's okay. But just not really knowing what you need to get through today or how much you're supposed to be doing. And then, it's a weekend before the exam and then you're extremely stressed. So if you just kind of have a better schedule, then things will be better. Um, for pre-meds, I would say don't give up. Don't give up no matter how long it takes you. If this is really what you want to do. So figure that out. But if this is really what you want to do, don't give up no matter how many years it takes you. I'm one of the older people in this class and I'm still here. Taking the MCAT multiple times, multiple years off, worked as a medical surgical assistant for a bunch of places, and you can do it. There's no age cap. Just if it's what you really want to do it.
Yeah. For reference, the oldest person in our class is 42, I believe. And be on the lookout. They might get a feature on the channel, and I already talked to them about it. So just a little preview. I would say is the biggest thing for M1s is to find your tribe. Find your people, and don't just find them, but like lean into them as well, and really be open and vulnerable with your people. Because these are my people minus one. Shout out to Alexis. She's in the army. She did HPSV, so she's actually doing her officer training right now in San Antonio, Texas. So shout out to
She's
her.
in Oklahoma, actually.
Oklahoma.
Yeah.
Oh, excuse me. I thought say
She's gonna be there for the last 3 weeks.
Oh, okay, okay.
Yeah.
So Oklahoma, San Antonio, doing her officer training. So salute to her service. Um, but yeah, like find your people and really open up and be vulnerable about like the things that you're going through. Because I know like I told them a lot of stuff like about what's going on for me, and it's just nice that to know that like somebody else knows what you're going through and they can help support you, and like they can just give you words of encouragement of like it's going okay, and then they might just open up like, yeah, I'm actually going through this similar experience as well. And it helps you not to feel alone, helps you to know like you're not the only person that's experiencing this, and you'll have the people around you that can help push you and keep you motivated to go through and like to get through this really rigorous experience. So like definitely find your people and like lean into them and create those bonds because these bonds will last past medical school, past residency. You'll be probably I might end up in the same city, referring patients to each other and all that type stuff. So like definitely find your people and use your resources. Like if your school, has certain resources, make sure you're using those early and often to really kind of help you overcome any challenges that you're facing. Um, yeah. So that's it for this video. Thank you guys for watching. I want to thank future doc Raisa Fouché, future doc Darius Lacey for joining me in this video and talking about their first year experience. I appreciate you guys. They will probably definitely be featured again. So stay tuned, stay prepared. Thank you guys for watching. Future Docs